So here's something interesting. What does the South African law say about illegal immigrants getting free healthcare in South Africa? That's what I want to discuss today. See, the South African National Health Department's total budget is set to increase from 277 billion rand in 24-25 to 296 billion rand in 25-26, what we're currently in. Now, relative to these amounts, district healthcare services are set to receive 132 billion rand. Central hospital services will receive 58 billion rand. Provincial hospitals are set to receive 49 billion rand. And other services related to health are going to receive 47 billion rand. And then there's the smallest portion. This portion is going to go to facilities management and maintenance. Only 11.9 billion rand is set to be allocated for this. Now, when you look and take into consideration the state of public health care facilities, you would think that they would put a lot more emphasis into maintenance, but alas. Now, these numbers are very important for us to understand, because when you isolate national health funding in South Africa as a singular focus, or even just as a department, it is the fourth most funded department in South Africa, after education, which is first at 508 billion rand, social development at 427 billion rand, and 424 billion rand goes to the most cringe part of this all, debt servicing costs. Then you get health services. Further to that, there are now times in South Africa where we are having a conversation around who we are and what we aspire to be as a nation. We're having these type of conversations from the perspective of how we feel. And more often than not, we're having these conversations from an opinion-based aspect. So we need data to kind of back this up. So in this video, we're going to look at one particular aspect that is taking up a disproportionate amount of our airtime, our media time, our social media time currently in South Africa. I want to talk about healthcare. But specifically, I want to talk about healthcare when it comes to undocumented immigrants accessing precious and very limited healthcare resources here in South Africa. It's actually a pretty heated issue right now. I'm sure you've seen the posts, and it's often overshadowed by very strong debates and very easy for people to say it's xenophobia. But I want to actually have this conversation. Now, unsurprisingly, a lot of these conversations are pointed towards Zimbabweans, Mozambicans, Nigerians, and even people from Lesotho. Specifically, illegal immigrants from those places, not legal immigrants. This has become a focal point due to our shared borders and significant migration patterns here in South Africa. So it's an issue. Now, legally and ethically, our constitution seems pretty clear on this. And many believe that the constitution in itself is actually hindering the real progress on many of the reforms on issues that are needed here in South Africa, and in particular this health issue. The reality and the practicalities on the ground are that we have a public health system that is already struggling. Everybody knows that. If you visited a public health facility, you know that it's struggling. We have limited resources, and there's also a real sense of unfairness from a lot of people that's starting to bubble up. That as a nation, we're being constitutionally bound to providing healthcare for all, when the all don't do it for South Africans in their own countries. These are the realities that we need to face. We could argue around immigration services till the cows come home, but the interim health crisis or situation that is happening in South Africa rages on.
Say whoever ongana documents, ongana medical permit must not come and get assistance in the public facilities. They must go to private hospital and private clinics. That's what we are implementing in the Constitution of South Africa, which is the law. And it says, we continue, says, the Criminal Procedure Act of 1977. As a South African, seeing undocumented foreigners accessing our facilities, we must make a citizen arrest. That's the Criminal Procedure of 1977. So that's what all we are here for.
Our politicians here in South Africa like to take the moral high ground when they themselves don't actually use public health centers. And if I'm wrong, prove me wrong in the comments. That's the other cry here. They aren't affected by these comings and goings within the health industry, but also they hide behind laws that they must surely know are not benefiting South Africans. Okay, but before we start to speculate a lot, let's start with what the law actually says. Section 27 of our constitution is incredibly broad, and that might be a problem. It says that everyone has the right to healthcare and that no one should be refused emergency treatment. This doesn't actually distinguish between citizens, legal residents, or undocumented individuals in South Africa. It says everyone. And this is where a lot of the angst comes from when South Africans are actually crying out. Because if this section, in fact, if all of the sections were all written as every South African, then this would be legally very clear. There'd be boundaries. In fact, for those who are legal minds, right? For those people that are legal eagles, or actually understand the law and the constitutional law a lot better, are we grasping at straws here? Is there something that we're not seeing, something that we're missing? Is the constitutional definition too broad, specifically for this issue and other issues? Let us know below in the comments and let's get the conversation going. Okay, our National Health Act from 2003 actually reinforces this idea, promising free primary healthcare at public facilities. And of course, South Africa is a country that actually likes things. We've signed into a lot of international human rights treaties. I'm not saying it's right or it's wrong, but these treaties push for non-discrimination and the right to healthcare for all. However, on the other hand, this is about a deep commitment to human rights and public healthcare. I'm not saying it's not. But if we deny care, we risk discrimination, poorer health outcomes, and the spread of infectious diseases, and ultimately far more expensive emergency interventions down the line for those who might actually be here legally or even illegally. That's what we're bound to. So there is that to consider. Ethically though, from a medical care standpoint, our healthcare professionals are actually bound to help regardless of immigration status as it currently stands. But there is a gray area that we all need to come to terms with. But I can tell you this, the South Africans, the people on the ground, they're starting to be fed up.
Go back and fix your own country. Go and face your own government. South African public hospitals and clinics are for South Africans and nobody else. We also have our own problems. We need to fix it in South Africa.
We are currently at the Hillbroad Clinic to enforce Section 17 of the Immigration Act. Under Immigration Act 13 of 2002, Section 17, that reads, if you are a foreign national, you need to produce a medical permit and go utilize a private hospital. We came here on Friday. We found there's a lot of people in big numbers that were here to seek medical attention. And I can tell you now, 70% of the people that were here were all illegal immigrants.
But there's another kicker. This very broad mandate often clashes with our Immigration Act. Imagine that there are so many healthcare providers that are caught in the middle of this. You have the constitutional duty to actually treat people and patients, but then there is this legal pressure, or at least a perceived one, to check for immigration status. Now, this ambiguity, unfortunately, it can lead to people screaming medical xenophobia or xenophobia in itself. It's very easy for people to do this. In fact, NGOs are probably screaming this right now. The gap between what the law says here and what happens on the ground is a huge source of tension. One that must be actually resolved in order for us to get over this. But how could we solve this? How can we start to be more fair to South Africans first? Am I even wrong for saying that? I don't know. But I want to prioritize South Africans. There's a widespread and very powerful belief that undocumented immigrants, especially those from countries like Zimbabwe, Nigeria, Mozambicans, Lesotho, etc., that these people are overwhelming our public healthcare system. We all remember the viral incidents, the one of the Limpopo health minister, who's actually now the premier of the province of Limpopo, Dr. Poppy Ramathuba. And it really showed the deep feelings amongst even some officials, how they feel that their hands are tied, and also citizens who feel that non-nationals are taking resources meant for South Africans. Here's some context.
You speak Shona, and then how do you find yourself in Vila when you are supposed to be with Munangago? You know he doesn't give me money to operate you guys, and I'm operating with my limited budget. When you guys are sick, I'm hearing these days, you just say, let's cross Limpopo River, there's an MEC there who's running charity department. It's not. And I'm going to tell you something that is truthful and painful. You know Stats SA goes and count people during the census and tell me that in Limpopo you have got 5.7 million people. And tell me out of that 5.7 million, 91% do not have medical aid state. 9% they will say has got medical aid, they depend on private hospital. And then they go and give National Treasury. When National Treasury allocates its budget, they said Limpopo has got 5.7 million people, and they subtract the 91, the 7%, 9%, and they give me the budget of the 91 to do all these operations. Now, I am here, instead of using the budget for what it's meant for, I'm operating for what Mnangagwa is supposed to do. And that is why when my people of Limpopo want health services, they can't get. And that is angering the community.
Let's actually be clear. Our public healthcare system has massive problems, completely separate from migration. That must be said. We've got chronic underfunding. We've got a severe shortage of doctors and nurses. We've got crumbling infrastructure, mismanagement, corruption, and also there's the burden of things like HIV, AIDS, and TB. Yes, these things are there. These systematic failures, they also create an environment of scarcity and frustration amongst the people who are looking for that care. South Africans, South African citizens. Especially when there is extra demand, things just don't seem to work for them. Now, the research that I could find suggests that the actual numerical burden of undocumented migrants on the healthcare system nationally is probably less than what we're feeling. But you have to consider the burden on the provinces that actually border these neighboring countries. That's where it's being felt the most. That's where the people from those places are starting to say, hey, we've got a problem here. Most immigrants move for economic reasons, not primarily for healthcare. This is very important to understand. However, the concentration of these migrants in specific areas like border regions, like Limpopo, Gauteng, a Free State, Mpumalanga, and other major cities, this can create real pressure points in facilities that are already struggling for the basics. Now, when you see non-national patients in queues and in wards, it starts to fuel that perception that we're being overwhelmed, regardless of what the actual national numbers say, the overall numbers. But there's also a cost to that. While preventative primary care is definitely most cost-effective in the long run than treating advanced diseases and emergencies that might be coming from other countries into South Africa, the immediate financial burden of providing that free primary healthcare to a large uninsured population, including illegal, undocumented individuals, is actually very real on South Africans and especially on those tax rands. It falls directly on our already stretched provincial health budgets. We have something that is also called uniform patient fee schedules in South Africa, which theoretically requires payment for those that are not eligible for free healthcare. But enforcement of this is often inconsistent. And think about it, you're trying to collect fees from somebody that's undocumented, often destitute individuals as well. It's just not practical, really. So it's kind of like we have a way for people to pay, but we don't really have a way to get them to pay. For instance, a report from 2022 states that some public hospitals in South Africa had, by then, in 2022, already started charging foreign patients for full fees. Like for a bed only, one has to pay around 2,300 Rand a day, and there's an 8,500 Rand charge for normal birth deliveries. That's what the report was citing. This was at places like the Steve Biko Academic Hospital in Pretoria. Now, if the patient was there for a C-section, it would be a lot more, around 11,600 Rand. Now, NGO and the likes, they see this as a bad thing. They say that this is actually too expensive. But let me ask you, the person watching this, should South Africans not be charging for these type of services to people who are coming from the outside? Because we pay when we go to these places in the outside. Let us know in the comments. Let's actually get into a different approach. What if it was us in those other countries? It's actually interesting to look at Zimbabwe's healthcare system through a comparative perspective. It's a mix of public and private, but their approach to non-citizens is fundamentally different to that of South Africa. Zimbabwe doesn't pretend to offer free healthcare to foreigners. Both public and private facilities expect payment from non-citizens. Public facilities charge fees, often on a sliding scale, while private care is much more expensive. Their focus on national health insurance is explicitly for citizens. This is key. For undocumented immigrants within Zimbabwe, the situation is incredibly difficult. There are fears of deportation, lack of funds, and there's also institutional barriers which severely limit access to even basic healthcare in that country. While emergency treatment might be given on humanitarian grounds, comprehensive and consistent just primary care is virtually impossible if you're not paying. Crucially, Zimbabwe explicitly advises that all foreigners must get comprehensive international health insurance before they enter the country. This is what they say. This, for them, shifts the financial responsibility away from the state and onto the individuals or their insurer. This model seems fair, right? This model, while certainly presenting humanitarian challenges for vulnerable, undocumented individuals in Zimbabwe, it actually demonstrates a very clear principle. If you are a non-citizen in Zimbabwe, you're generally expected to cover for your own healthcare costs, often through insurance, etc. You can't rely on the state to actually do that for you. Can you see it? Can you see the comparison here? What is actually so hard for us to grasp this? You pay for what you get. In Nigeria, one generally does not actually get free healthcare as a foreigner, let alone as an illegal immigrant. Foreign nationals seeking medical services in Nigeria typically you are responsible for your payments towards the treatment in both private and public healthcare facilities. In Mozambique, from their 2004 constitution, it actually contains provisions that are related to healthcare. Take, for instance, their Article 89, which centers around health. It actually states that all citizens shall have the right to medical and healthcare within the borders. The full wording actually implies that there are limitations based on resources and legislation. Still sticking with Mozambique, when looking at Article 116, it further elaborates, medical and healthcare for citizens shall be organized through a national health system which shall benefit all Mozambican people. The use of the terms citizens and Mozambican people, this suggests a primary focus on their own people. This is what our neighbors are saying. There actually isn't a free healthcare ride in these nations. This is what's clear. But here in South Africa, our moral high ground and being stuck to what many feel, what I also feel, are constitutional handcuffs outside of practicality. These things will be our downfall. The question of healthcare access for undocumented immigrants in South Africa, it truly puts us as a country at a constitutional crossroad. Our principles, profound systematic failures, and even our limited resources, these things are very real for us. They're real concerns. We have to think about things like sustainability and fairness. These things now hang in the balance. While the legal and ethical arguments for universal access to healthcare, these things are very powerful and they're very much needed. Their implementation in our current context, it creates an unsustainable burden, one that is fueling a lot of what we're seeing out there, people being blocked. And also this risks further sentiment, things bubbling over. But if we, the people watching this, and our government ignore this strain, we risk collapsing the entire South African healthcare system for everybody, not just the people that we're trying to help. Many would say that if we simply deny care based on citizenship status, then we would be violating fundamental human rights and public healthcare principles. But what about the South African principles of providing for South Africans? But why aren't a lot of these countries doing the same thing for us? Where's the reciprocity? Our goal here isn't to abandon humanitarian principles. It's to create a healthcare system that is both ethically responsible and practically viable. It's got to make financial sense. We've got to have a system that serves South African citizens efficiently and effectively while managing the realities of cross-border healthcare needs. We've got to restructure this. To be fair, it's going to take a lot of consultation to find a sustainable way that can be done long term. But there are models out there that can help us, because in the long run, the status quo serves neither our citizens or even the undocumented immigrants. That's just my Hippocratic view. What's yours? Thank you for watching this video. Hopefully it was as interesting for you to watch as it was for us to make. Check out one of these other videos and hopefully they'll be just as interesting and hard-hitting as this one. Cheers.